Good morning. My name is Kate Chandler. I'm a behavioral health consultant down on at the Downtown Family Health Center at Circle the City, and we are located in the zone of Phoenix. And I wanted to take a minute to talk with y'all today about how experiencing homelessness affects the brain. And the reason I think this is really important to talk about is it's something that we work with in the clinic and can help us better meet clients where they're at. And it can also help us have a lot more compassion and empathy, and just recognizing that we really never know what anyone's dealing with. So when someone is experiencing homelessness, several things that people talk about are the daily stresses that they live with. And when dealing with the kind of stressors that you deal with when experiencing homelessness, you're living in the survival brain part. So when we're in survival brain, that's something we also talk about as far as like fight or flight or freeze or fawn response. And when we're in that, we can't access regulating mood, making decisions, problem solving. So imagine how difficult that has to be getting through the day. How this may look in the clinic or when working with folks, this may seem like, wow, this person seems to be very impulsive or making decisions that, I don't quite understand. So if we're able to step back and realize where someone is coming from, that can help us better work with them and not just go on the initial response that we're seeing. What some clients have shared with us, even just in a typical day, people are having to negotiate, do I go to a meal or do I go to an appointment? If I go to this appointment, will there be somewhere I can use the restroom? Do I risk being assaulted when I go to this meal as opposed to this meal? And sadly, coming out of the summer, this sometimes means, am I going to pass someone who's deceased on the sidewalk on my way to the bus stop? And so this is all what might be going through someone's mind, regardless of their history, just trying to go to an appointment. So when we see someone who might seem initially upset or unable to articulate what they're coming in for, one thing that we can do is try to help at least temporarily regulate the nervous system, which is really hard in this environment because it's very hard to sleep. It's a very stressful environment. But something we can do is, sometimes it seems as simple as offering food and water, letting people sit for a minute, be in a quiet room. So what this can do is let someone have a chance to respond rather than react, and can also help someone feel heard, because we can say, hey, I don't even know what you probably went through to get to this appointment today, but we're here to help, and let's give you a minute so you have a chance to let us know what's going on, and we can build a better relationship from there. So this is something too where, even working in other settings, unfortunately, because there are so many people who are unhoused now, you may encounter people in different settings. So can you be flexible with your no-show policy? Can you have snacks on hand? These are some things that can help people feel seen and heard and understood, and really give them a chance to get the most out of their appointment and time with you. So I appreciate you letting me share this with you today. And let's just remember, we never know what battles anyone's going through, so let's be kind to each other.